I am so delighted to meet you in the program of 1 minute please. What is atypical pneumonia? You all know that atypical pneumonia is a part of or subset of community acquired pneumonia, but why it is referred to as atypical pneumonia? Because the atypical refers to organisms are atypical. What I mean, the atypical organisms are Legionella, Chlamydia and Mycoplasma. Why it is called atypical? As compared to routine other bacteria, this atypical organism lack bacterial wall. So, the drugs that are routinely given, for example beta-lactam, these act against the cell wall of bacteria by which it kills bacteria. But here the atypical organism, since they lack bacterial wall, the beta-lactam antibiotic can't act against these organisms anymore. So, beta-lactam antibiotics are not useful in the management of atypical pneumonia. That's why we prefer macrolide, something like azithromycin or doxycycline. 1. And 2, why it is atypical pneumonia? These symptoms are atypical. What I mean symptoms are atypical? Yes. As compared to the symptoms exhibited by routine pneumonia, including high grade of fever and tachypnea and pleuritic pain and severe dry cough followed by purulent cough, here more than the pulmonary symptom, the extrapulmonary symptoms are pronounced. For example, in Legionella, when it is associated with hyponatremia, they will present with altered sensorium, I mean altered mental status, and they will have gastrointestinal symptom, something like diarrhea and vomiting. In the case of Mycoplasma pneumonia, they will present with otitis pneumonia, Stevens-Johnson syndrome, and they will have features of hemolytic anemia as compared to symptoms of routine pneumonia. So, they will have potential extrapulmonary symptom as compared to pulmonary symptom. And why again it is referred to atypical? These organisms are very difficult to be cultivated on routine culture. You can't be found out on routine staining. Because of all these reasons, these are collectively called atypical pneumonia, and moreover, very shockingly, it is called walking pneumonia. What I mean, they may have decreased saturation but in the presence of almost normal symptoms. That's why they used to be called as walking pneumonia. Because of all these reasons, they are called atypical pneumonia. Thank you.